Well, thank you very much and good morning to everybody. This is Flashpoint, the voice of national unity, and I'm David Coty. As you may be aware, I'm here on every Friday beginning from 10:30 to 11:30 with the program Flashpoint. And most of my guests are medical practitioners. And this time we are going very wide, very big. We are on Facebook, on my personal page, David Coty. We have roughly 5,000 members or followers. And then at the end of the day, we're going to be also on Flashpoint, which also has a lot of members or followers, and also on YouTube. What is happening here is that my personal page is what is being used now to do the Facebook work with all of these 5,000 people watching around the world. And then it's uploaded on Flashpoint at the end of the program. I didn't say day after tomorrow, but today. And according to the Facebook procedure, I don't know how to do their thing, but we are going to be going live also on Flashpoint in 60 days. Some of the 60 days have already elapsed, so we're going to be on Facebook, Flashpoint Live, and also on YouTube Live. But for now, you are on my personal page live, and by the end of the day, we're going to be on Flashpoint. I've invited again Dr. Moses Tarawale and Madam Agnes. Antaye. Are you all right? I'll get used to it. Well, the both of them are here today to talk about very sensitive issue: misuse and abuse of antibiotics. We're going to begin by asking Madam Ayali to tell us a little bit about herself. She is the laboratory supervisor at Jahmale, and both of them are from Jahmale Medical Solutions. But Madam Ayali will introduce herself. Just tell me who you are.
Okay, my name is Agnes, for short.
Yeah.
And I'm a lab scientist by profession.
Okay.
I graduated from University of Ghana.
Oh, good.
And I'm here to inculcate the good lab practices in Liberia.
Okay.
And I've been here since 2008.
Okay.
And it's been a great experience in Liberia.
I'm
currently the laboratory supervisor in Jahmale Medical Solutions.
Yeah.
And it's been a great one.
Yeah.
Yeah. And nice having me on your show.
Okay. How are you enjoying the food here? Which food have you?
My best food is potato greens. I can do it anytime.
Huh?
Yeah.
With red oil or the fried one?
No, not red oil, the fried one.
The fried one. Oh, I like that. And do you know that Ghana is my second home?
I didn't know that.
I've been there 5 times.
Oh.
My first trip there was in 1974.
What's your best food? Not say fufu.
No, not fufu.
Okay.
Tapioca. Is it a food?
It's not a Ghanaian food. Maybe that's Cote d'Ivoire.
Oh, okay, all right.
Tapioca is cassava.
Okay. All right. Okay, Dr. Tarawale, each time I ask you to introduce yourself, it means that people who watch you here before may not be the same people watching today. So please tell me about yourself. Don't talk about the SDA days. No, don't talk about no old days here. All right.
Dr. Moses Tarawale. I'm a graduate of AMWT College of Medicine, 1986.
Wow.
Worked at JFK, worked also at SDA Cooper, and then went to the States, studied family medicine, came back 2013. I've been back since then. I've been working at Firestone since then, 2014. I left Firestone 2020 and came back to Monrovia, worked at ELWA in the Faculty of Family Medicine as one of their doctors trainers, and also was the Chief Medical Officer or the Medical Director there at ELWA. Presently, I'm with Jahmale. I run a clinic in Uclutown Monday through Fridays, and sometimes I also come to the central office, which is at Abitogo Road.
Okay. We need to make this clear. You don't run a clinic there, but you run a branch of Jahmale there, which is the Jahmale a nucleotide branch.
Yes.
Once you run the clinic, you look at your private clinic, you run it there. You're not running your public. You're not running your private
I'm
clinic.
not running my private clinic.
You are running the branch of Jahmale.
Yes, which is a clinic there in
In
Newcroton.
Newcroton, that's
By
right.
Redemption Hospital.
Right, and I like to tell the public that I have been there twice on my general checkup. It's an excellent place to be. The only difference between there and the headquarters is that here you may want to do some imaging, the MRI, the CT scan, you find out here, and maybe some other X-ray. But when you go to the Newcroton branch, my friend, you get the same facility and much cheaper there. They did it that way because of the community. What are you here for today? We're talking about misuse and abuse of antibiotics.
We decided to do this because of many factors. Antimicrobial resistance, which is called for short AMR, is a global pandemic, a global health concern. Even in the developed world where you do not buy any antibiotic or any medicine without a prescription, you have drug or antibiotic or other medication being abused and misused. So, Liberia,
I like the two words you put there. Now, make that clear for me.
we will come to that.
Oh, okay.
So, it is something that happens. We as human beings have defense mechanism that God placed in us to fight against anything that enters our body without us welcoming it.
Okay.
When you eat, you are welcoming the food in your body. When you drink, you're welcoming the water or whatever it is in your body. But there are organisms that will not be welcomed by your body, and they come in, and the body is going to find a way, excuse me, to defend itself. The same thing happens with bugs. Bugs are germs. They can be either a bacteria, they can be a fungus like hair kingi or ringworm or dish clot. They can be a virus like herpes simplex or hepatitis or HIV. They can be a parasite like malaria, or it can be a worm inside your stomach. So those are all bugs. The bugs also want to survive. So what do? They develop mechanism within their bodies to survive. So when we say antimicrobial resistance, what we mean is that the same medicine that used to kill this particular thing, or the same medicine that used to stop it from growing, no longer does that. So the bacteria or the bug becomes resistant. And they call them superbugs in America and other places. The superbugs. So that is what it is. Now, abuse is when you take a medication without being prescribed that medication. Misuse is where you are giving it by a doctor or by a PA or by a nurse, and you take it, instead of taking it for 7 days, you take it for 2 days. And because you feel good now, you're feeling much better, so you stop. Okay? So you are not following the medical guidelines for that drug.
That is misuse.
That is misuse. Abuse is where no prescription for you, like what we do in Liberia. You just walk into a pharmacy and say, I want Septrin. You can be 2-year-old, you can be 2 million years old.
They give it to you.
They give it to you.
And
that
sometimes
is abuse.
And sometimes you even diagnose your own case before you go there. My man, look, I got malaria.
Typhoid.
What it is, typhoid, malaria? Yes, I got malaria. Let's come back to you, Madam Jahmale.
Yes, and Doc has really highlighted the main issue that we are facing. It's not actually just Liberia. It's not actually just Liberia. It's a global thing. WHO has actually announced that it's a pandemic. So how did this start? Scientists have been predicting that it may happen in future, but it went very fast. Why? Because of COVID-19. You know,
please speak a little louder.
Okay. You know, COVID-19, it gave the platform for a lot of abuse of antibiotics. We saw it was trending that you take this antibiotics, you are going to be at least immune against COVID-19. So the research were conducted after COVID-19 and saw that there was a big surge of antimicrobial resistance. With microbial resistance, we are not just talking about bacteria.
Mm-hmm.
We are talking about fungal. Fungus is Candida. Candida is one of the biggest fungus infection that we have in the world.
Candida,
yes, candidiasis
for
for women.
Women, we call it itchy fish.
Itchy fish. So with that, why is it that itchy fish is really persistent in Liberia? Because every month women use antibiotics without even getting prescribed. When you call, maybe you do a survey, because we also go to different schools to educate a lot of the girls on antibiotics misuse. What they do is every month they take antibiotics. Why are they taking antibiotics? Because they feel pain.
When they're receiving.
When they are receiving. Whenever they are having menses, they are receiving. They take antibiotics. It's like something that their aunties, you ask their aunties, their grandmothers already have told them this is what you should do. If you don't want to get pregnant, you take antibiotics. How is antibiotics connected to getting pregnant? So there's a lot of awareness that needs to be done about antimicrobial resistance. So what happens is when they usually take these antibiotics every month, they clear the good bacteria. We actually have a good bacteria in our system.
Okay.
It's called lactobacillus.
I'm just hearing that. Yes.
So the good bacteria help protect us. That is a God-made thing. It's a God-made system. We protect ourselves naturally. So the good bacteria protects the invaders.
I'm just hearing that today.
Yeah, they are good bacteria. Yes, they are good bacteria.
Yeah.
So the antibiotics now clear the good ones. So you don't get protection. So that's is yeast, Candida. Candida is an opportunistic person. It doesn't just come and fight and enter you. It wants no one to have any problem with it. The fighting mechanism should come down before Candida will come. So that is why you have a lot of girls having itchy fish, because they keep taking antibiotics, clearing the good bacteria in them. So the Candida keeps.
I hope they are listening this morning, because I too did not know that they were good bacteria.
They are actually good bacteria.
The whole body system has good bacteria. Even your skin. Our skin has bacteria to protect certain parts of the skin. But when you cut yourself and that bacteria plus the bacteria in the air enter your skin, enter through the cut, what happens is that you get an invasion. It's like what happened during the Yongbang invasion. Okay? Or that what happened in the Ukraine. Okay? War.
War.
Will break out. So the good bacteria then become overwhelmed by the bad bacteria that have entered.
Okay. Our supervisor for your laboratory there, how do you handle these cases?
So with us, we do a lot of culture and sensitivity. With culture and sensitivity, we'll tell you this is a particular bacteria and this is the antibiotics or antifungal or antiviral things that you should take. So what we are getting in the laboratory, that's why we think the awareness should be now. We have a lot of bacteria coming into the system that any antibiotics, even the biggest antibiotics that we have in the whole world, that we are not even supposed to dispense. You are not supposed to dispense it, because they are very strong grade of antibiotics. These are actually the only antibiotics working, and we cannot get it locally.
Sometimes we got to bring it from Ghana, or Nigeria, or from abroad for the person, and they got to take it intravenously through their vein or through their muscle, intramuscular, for maybe a protracted period of time. So what we are saying here in a nutshell is that antimicrobial resistance, or the overuse and abuse of medications everywhere in the world, has created a burden on the healthcare system. It becomes a very difficult disease to treat. Okay, it becomes very expensive to treat it, and sometimes it even leads to death.
Okay.
Many
a times it leads to death.
Okay. So the doctors now have to choose between saving your liver, because when you take any medication, your liver have to clear it.
Yes.
So if we are giving you a high dose of antibiotics, what happens is your liver becomes strained, and you have liver disease. And liver disease, we all know that is one of the key organs that we have. Even thinking about surgery. Now, in time to come, research has found out that we might not be able to have surgery anymore. So if you're cutting,
why?
Because when you're cutting someone open, you need to have antiseptic. The whole place should be very clean, and the whole place should be sterile for outside infection not to be on that open cut. So now, if you cannot sterilize the tools, you cannot sterilize your area, then surgery becomes a death penalty. Going to a surgical ward becomes a death penalty because we don't have antibiotics to fight those. The bacteria have become a war against us. So that's where we are heading now. And to stop that from happening, we need a lot of awareness from our own standpoint. Like a little things that we do, we should not be doing. We should start doing it now. Stop doing it now.
Let me come to you, Dad. You mentioned a very major thing that is happening in this country to women, is issue fish. We're talking about antibiotics, but please give us some education about this whole issue fish thing and how it can be handled. You have already told us some of the reasons, the causes, taking too much of antibiotics. Now, what is issue fish and what can we do to avoid it? But before you answer that, the program is Flashpoint, the voice of national unity, and I'm David Cote. We are here at ELBC 99.9, and we're here on every Friday. My guest today, Miss Anyeli, Agnes Anyeli, and Dr. Moses Tarawali. They are here to help us understand more about this whole antibiotics thing. Now, what is issue fish and what can women do to prevent it?
Issue fish is the local name for Candida infection in the vagina. Okay? And as Agnes rightfully said, it's because of the abuse and misuse of antibiotics that has wiped out the defense mechanism that God placed in women to protect them from foreign invasion of anything, including semen, the sperm that a man put into the woman. God gave women an ability to even defend themselves against that, even though it's a natural phenomenon for them to get pregnant. That's why the 20 million sperm cells that are put in there, only one can go and impregnate a woman, or maybe two. The rest of them are killed. That's the defense mechanism that God put in place. So when you're a girl, you start receiving. And every month when you're receiving, you go to a clinic, they give you gentamicin injection, you go, they give you ampicillin, amoxicillin, Septrin, whatever you're taking. What you're doing is the lactobacillus, which is the defender of that area of your body, is wiped out or suppressed or put in place and checked. So now you have foreigners coming in. People that are not supposed to be in that area start coming in. The most common,
no immigration.
No more immigration, no more checkpoint, nothing. So what happens is that this burger collie said, Canada now said, that is my time to go and enjoy myself in that place. He said, I'm on time now to eat. And I will eat until the oil run all on my elbow. So they remain there. Now they go to maybe a clinic and say, oh, after I finish receiving, I just see the white thing in. Then it came on my panty, thick, and it looked like milk or whatever, like spoiled cheese, bam, 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 bam. You know, and he itching. So that's where the name came from, itchy fish. So now, then they go and get them.
And what is the medical term, the medical name?
It's candidiasis.
Oh, candidiasis.
Yeah, but the big name for the whole thing around that area is also vulvovaginitis.
My goodness, come on.
Well, so let's forget about that.
Let's forget about that.
But the thing about it is that, so they go and take small flagell, or they take meclonazole, or they take cotrimazole. They insert in there for 5 days, 7 days, whatever time. By the time they take maybe the third one, they feel they don't see anything anymore. They stop. So what happens? The balance that remain there, it take hold. You say, oh God, you see now you want me to live rent free. I'm not paying rent anymore. I'm not doing anything, so I will just stay in their house here until I eat and eat and eat until my stomach get big. Then I lay down and sleep. So they remain there. Next month you do the same thing. you accumulate. Next month, you do the same thing.
Yeah.
You accumulate.
More
So you
rebels
keep adding. You keep adding. So the brother will go get a sister. The sister go get a cousin.
Yeah.
The cousin go bring their auntie. The auntie go bring her boyfriend.
Yeah.
The boyfriend bring their own son.
So they got free
By the
friends.
time you know, the whole place is full.
Yeah.
The house is full now.
Yeah.
And then when you pass it now, you spend it yourself.
Yeah.
You the woman.
Yeah.
Say, I take back, I clean myself, but I let it wear smelling.
Yeah.
Because it has become chronic in you.
Hey.
I wanted
Yeah,
to
go ahead,
just
Mama.
add a little what Doc said. Yes, a lot of people, a lot of women, many of them, because it's a persistent thing, they actually finish the regimen. They actually finish the regimen, the antifungal regimen. They finish it. They go per what the doctor is saying. However, they are using the same panties.
Oh, wait a minute.
The same underclothes.
She's coming to something.
Yeah.
The first group is the group that will not finish their medicine.
Yes.
It's like you got malaria. The doctor or the nurse say, go and take 20 tablets. When you take 10 and you feel okay, you throw the other one away. So this case is different from what you're saying now.
Yeah, that's the second group.
The second group. The second group, they will finish the medicine according to what the doctor say.
Yeah.
But they use one panty.
Yeah.
Hey,
There is
explain
one
that better.
panty. They would not want, some people, they've not thrown their panties for 1 year. A lot of people, they rewash.
I can't believe that.
They reuse it. So personal hygiene is very important.
Yeah.
And secondly, sexual partners.
Oh.
Yes.
Oh.
So if you have a sexual partner who has many sexual partners,
Hey.
so what happens is you are curing yourself.
But that's why I explain it in a elaborate way.
Yeah.
The uncle go bring his girlfriend.
Yeah.
The girlfriend go bring their daughter.
Yeah.
The daughter also bring her own boyfriend.
Yeah.
So you get a whole house that is full
Yes.
With different
different people. Because the man is eating all over.
Hey.
Yes, it's very common now. A lot of people have open relationships, but if you have that type of infection, you really have to tell your partner, yes, I have this infection and I have to treat it. I have to finish my regimen and clear it before any other sexual relations.
Yeah.
So that's what women can do to reduce, because a lot of patients and clients come into the clinic, they are very tired. They've done everything.
They've gone all over.
They've gone.
I want us to go back to that panty thing a little bit. I want you to explain that.
Okay.
You just mentioned something about promiscuity, multiple sex partners. That's very bad. But this panty issue you're talking about, when you say using one panty for long, are you saying that if I have one panty, I don't use panty, not me. If somebody has panties that they will use and wash all the time, and they wash it, I mean, maybe you got 2, 3. You wash and you use, you wash and you use. Is this still a problem, or are you saying that when the panty is on, you don't care to clean it at all?
What I'm saying is, if you have a Candida infection and you are trying to get rid of
I want to get a correct spelling for that. A Candida infection.
C-A.
Yeah.
Can. Ni. Da.
Oh, C-A-N-E-D-A.
No,
D-I-A.
C-A-N-D-I-A.
D-I-A.
C-A-N-D-I-D-A.
Oh.
Candida.
You know why I'm asking you? I'm just saying it to you, not to the public, and I hope you don't tell anybody. I come and learn from you.
Hey, no talk.
I have become a medical doctor for 3 minutes on the radio. So I'm
We heard you the other day talking about prostate.
Oh, yeah. Oh, yeah.
I almost sue you.
Oh, no, don't sue me. Don't sue me. I beg you. I learned it from you. I got to go teach you too.
Okay, with the
The
infection.
panty.
Yes. So with the infection, because it's persistent, Candida, looking at the whole biology of Candida, it has a lot of protective shells. That is why it's opportunistic. It's not something that you can get rid of very
Easily.
quickly. Yeah. So if definitely it would be on your panties. How much you use your cleaning, just burn everything.
Throw it away. Burn
Everything
it.
that you are using during that time,
Yeah.
you burn, you buy a new set.
They need to listen to this.
You buy
They
a
need
new
to
set.
listen to this. So,
And you make it a routine as a woman. Every 3 months, you get rid of your panties. At least every 3 months. Looking at the population, maybe they cannot afford to buy new panties every time, but make it 3 months.
Make it, yeah, that particular period, man, throw away.
Yes. If not, you'll be carrying things in and out of your system.
It's better to burn
and
it.
Women are
away.
open system. We can get, our urethra is very short. So before you realize it's gone inside.
Yeah.
It's right there. And the ability, some people would not go having sex, but they'll finger. That is also.
Let me get that.
Okay. They'll fingering.
Oh, to finger.
Yes.
You mean you finger yourself or a man fingering you?
Another thing that women do. Listen to me.
I want to get that clear.
Another thing that women do that is not recommended.
Okay.
Really, is not recommended by even gynecologists. Is douching.
What is douching?
They use some liquid. Some people, I don't know what they use, but some people use vinegar, various things. They put it in a pump, put it in the vagina, and say they're cleaning themselves.
Oh.
Some other women, every morning when they go to take a bath, they put their hands inside and clean themselves.
Oh, in themselves?
Yes. Some even take, the small panties that they normally, because most women bathe with their panties. I said, they take it and put it in there and clean. What you're doing is what we're trying to explain to the population. What you're doing is you're cleaning off the good bacteria that got put there.
And you're introducing.
And then you're introducing new ones that you don't know what they are. Because your finger, the panty that you're using, and the water, even the soap, can all have germs on them. Because you leave the soap openly in the bathroom. And anything passing.
I promise you, I will find a time to repeat this program or get you back. This is important because many ladies are making this mistake.
Yeah.
They think it's a good idea to do this in the clean yourself, and you just talk about good and bad bacteria. I didn't know that.
Yeah.
I just know bacteria to be something bad.
We have a lot. We have one even in our digestive system.
In the stomach and all.
E. coli.
Oh.
It helps also maintain the environment.
I'll find a time to repeat this program because most people need to know this.
Yeah.
Some ladies listen to this and they may be telling their children, don't do it. I did it many years, don't do it.
I'm used to it and it has not done anything to me.
Yeah, fine.
But the fact of the matter is that it is dangerous, especially for the newer generation. The reason why we're repeating this thing over and over again is because the newer generation are promiscuous.
Yeah.
Our mothers, our aunties, our sisters, in those days,
one
man, one woman.
Yeah.
But nowadays, that's flakaje.
Flakaje. and rakaje.
So if you are one man, one woman, then it's easy for you to eliminate or to treat yourself quickly and this thing goes away.
Yeah.
But when you're doing flakaje, anybody that can, the draws and the brief come down, then you know what is going to happen. You're going to have.
We'll soon be going to the lines, and I will be taking some calls from the public. Our program, the format is 1 hour. The program is 1 hour, and the format is the first 30 minutes we talk, and then there's 15 minutes for the public to interact with you. In the last 15 minutes, you respond to all of their questions. So we'll talk. Just tell me what we didn't touch.
One thing we didn't touch is how do the medicines that we're using don't work on the bacteria, on the virus, or on the fungus, or on whatever it is, parasite, why it is not working. Like we said from the beginning, the bugs that bring these sicknesses are also trying to defend themselves. And they do it in 4 or 5 basic ways. One way they do it is that the mechanism that the antibiotic or the medicine work on is either to attach itself to the wall or penetrate through the wall and go into the bacteria and do what they want to do, or they find a way to get into the bacteria and cripple them. So what the bacteria does is, maybe the way that the antibiotic works is to get into a way, a pathway. So it changes that way. It changes that road. So the antibiotic is not able to pass through that pathway anyway. Or the area that the antibiotic is supposed to hit itself in or attach itself to. They say, okay, no problem. They reprocess that area. The antibiotic goes there. It can attach. Or the antibiotic is able to enter the bacteria or the organism or the bug. Then they say, okay, I will develop pumps, water pump, to flush you out. So they develop water pump within their body, and they flush the antibiotic out. We call it X-flu. They move it out. Just take it out. So the organisms are very sensitive to what is going on. In those days, chloroquine was a treatment of choice for malaria. It came to a point
it couldn't work.
The malaria parasites say, "You wasting your time.
You're wasting your time.
I got to survive."
We got a new defense.
So I'm going to put up a new defense. Chloroquine became useless. Then we went to quinine. Quinine became useless. Now we are on antimeter. Recently, we've noticed that antimeter is becoming resistant. If you want to do real justice to malaria, you must do both the injection and the tablet for 6 days.
My goodness.
Yes. Then you are able to fight it. If you just do injection for 3 days, you're wasting your time. Yes. So that's how the organisms do. Or sometimes they bypass the coding that the antibiotic or the medicine get with the bacteria. There is a coding that happens. So the people who are making these medicines, they study the bacteria and decide that, okay, like tetracycline is going to join in the 30S, a subunit of the organism. So the organism say, okay, no problem. Instead of 30S, I make it 75S. I just change the coding. It go in there, but it can pass. So bacteria or bugs, the librarian way, bugs, not bed bug.
I know.
Bugs are very, very sensitive. They need to survive. So they also fight hard to study what the antibiotics or the medications are used for, how they enter them, how they block them, how they stop them from growing, and they turn around.
As scientists are studying, doing more studies, the medical doctors are improving. They too, those enemies are getting prepared for them.
Oh yeah, just like how the rogue then, when you do all your security system, the rogue can still bypass and enter your house.
So WHO, WHO is now saying it's not that we cannot produce new antibiotics. That's not the issue. But the rate at which the bacteria are getting resistance is faster than how we can produce
manufacture antibiotics.
Yes, new antibiotics. So if we are, the balance is not there. So we have to reduce the resistance so that they can match up the production of new antibiotics.
I see. Well, thank you. We will now take a short break, and when we come back, we'd like to ask you, the members of the public, to participate by asking some questions. You'll be free to ask any question, but please restrict your questions to the topic today so that we can be able to get more understanding of what we're doing here. After the break, when we come back, we expect you to call on 0777 511 977. 0777 511 977 or 0886 511 977. When you call those numbers, they'll be able to answer you. Please, especially ladies, feel free. But like we're always saying in Liberia, don't be ashamed of asking questions on your health. It is better to know it now than, I have always said one thing. Being informed is far better than facing the consequences of your ignorance. I repeat, being informed is far better than facing the consequences of your ignorance. You better listen now and do something about it. Don't just listen, do something about it. Let's take a short break.
Water means life. Life is water. Join the pure